So what are we currently aiming to achieve? Where are we at the moment? And what are our goals? So clearly, as we are promoting and wanting to support and wanting to govern the research uses of health data, we have to make sure that everything that we do helps to support the research platforms, people like Mats and Brecht, who you've heard before, and others, including Bart, who you'll hear a bit later. We have to help ensure that the work they do, the projects they run, the solutions they create do comply. We need to also try to help ensure, both as a compliance issue, but also I think for society, it's important that we help to grow consistent practices across Europe, even if there are exceptions in different member states, and therefore the rules of the game are a little different. It would be nice if we could aspire to having a singular set of practices that Europe can hold its head up and say, this is how we do things, and it actually complies with all of the 28 member states' rules and regulations. So that's something that we really want to do, and codes of good practice is an important starting point for us. We also do need to ensure that these documents, these codes, are regularly updated, because this phrase, state of the art, is a difficult one to meet, because the antagonists who want to break into computing are always on the inventive side, and those on return who develop security measures are also on the inventive side. So our codes of practice have to reflect an ongoing evolution in ICT capabilities on both sides of the equation. But what are we wanting to achieve? Why do we want to do this? It's because we need to create confidence and reduce the risk of those who provide data for research. So if we take as an example a hospital that is considering joining a clinical research platform, or is going to consider joining the EMIF Federation you'll hear about later, how does that hospital weigh up the pros and cons? Can we help de-risk the situation and give the hospital confidence that by joining this community, by sharing and using its data, it is actually in a relatively low-risk state? But likewise, we have to also help those who are wanting to take this brave step, those who currently do old-fashioned clinical research, if you like, who don't use big data today. But those organizations are also risk-averse, like pharma has to be risk-averse because they are not necessarily favored in any judgment or call. They are pilloried, in fact, usually, if anything goes wrong. So we have to also help them to manage their risk in taking the brave step of using clinical data in new and exciting ways. And as I mentioned in my opening talk, I really want us to get to the point where we don't say to society doesn't say to us, patients don't say to us, yes, okay, you may. No, that's not good enough. What we need to achieve is a warm welcome, a positive endorsement. This is great. We want you to do this. And that's really where I hope we can reach. And only if we achieve those things can we then enable the scaling up of the learning health system. So you heard already, and I think I'll skip this slide except just to summarize and say that you've heard already from the two presentations of Mats and Brecht that there are a number of measures already built into the way EHR4CR has done things. And I think Bart will also speak a bit later about how EMIF is working to protect the way big data are used as well. So what I would like to do is just to really, in a way, emphasize the fact that if we look at these different projects that have been working in the space, and Brendan is here from Transform, which is another project that has looked especially at primary care general practice data, and how can we build a learning health system, ecosystem, in a trustworthy way. I'm not going to speak to all these bullets. All I want you to do is to scan them and realize these are good bullets. They're all good, useful things. What we really need to do, and one of the goals of this institute, is to take these great components of the solution space and try to bring them together. So that's really where we want to go. We know that there is good work already done. We don't need to start from any clean sheets of paper. There really is a lot of great work, and what we will be doing is trying to harmonize what exists and grow where there are gaps strengthen where it's weaker, and take into account the new landscape, as Nicholas helped us to understand, that is perhaps at the moment a little uncertain, but where clarity might follow. So we've got a number of items in the pipeline, and you're going to hear a bit more about these over the next few minutes after the coffee break. Quality labelling, so that actually the ICT tools that are leveraging clinical data at a research level are themselves quality assured. The codes of practice that we need to support the feasibility and remote access services that you've heard about, standard operating rules and standard operating procedures. Pascal will speak about the first bullet after the coffee break. Peter will speak about the next 2 or 3 bullet points on this slide, so I won't say any more about those. But I will just speak about the last 2 bullet points that will appear on this slide. This one is about staff competence. We've recognized that the staff who are going to be doing new things with health data in a research context themselves need to be competent. They need to be trained. We need to all have confidence that the staff know what they're doing, and if something goes wrong, which occasionally it might, because IT, like anything else, is fallible, how do they know what to do when they start to sense that maybe they're seeing some data they shouldn't, or data is somehow not as de-identified as it should be, etc., etc. How are they trained to handle that? And also, what are we going to do as IHD around trying to provide a more formal governance layer to what takes place? So I'm going to speak to these last 2 bullet points briefly, if I may. So on staff competence, we had the benefit of working very closely with an organisation called UK CHIP, which has already done a lot of work on competence developments in informatics, and they focused especially on the EHR for CR project and looked at what would be the kind of expectations on staff using effectively the Insight platform at the hospital end, at the pharma end, and inside Breast Company itself, and all of those other service providers that Brecht described. What are we expecting them to do? And of course, what I've just put on the slide is some basic principles. What lies behind that is a checklist of competences, of compliance rules, and what we would like to do is to work with some of those early champions to put those into practice, probably needing to improve them as we go, and really to start to develop an expectation and an assurance that staff who do finger the data for research are themselves competent, well-trained, and supported by higher management appropriately. In doing this, I mentioned earlier on in the morning that we are working adjacently with other organisations, and here I have just a slide. I'm not going to actually speak to it, but ECRIN is an important player already in providing a number of European-level assurances for clinical trial centres. Some of you may be familiar with ECRIN, some of you may be involved in ECRIN, or may have been ECRIN accredited. This work on staff competence, and also the work that Pascal will describe after coffee about certifying systems, is something that we are positioning as being non-clashing, complementary to what ECRIN currently does, so that we are working with them on these kind of things, and we very much welcome that. We will appoint in the coming weeks an information governance board and define and publish its terms of reference, and this board will have a formal role, but voluntary adoption by the Champion Programme, but it will have a formal role because they will voluntarily agree to be bound by its formality, that actually the ecosystem operates appropriately, that the codes of practice that we develop, that Peter will describe soon, are actually adhered to. We will have some powers to inspect where appropriate, and even some light touch sanctions that we can apply. So this is the kind of activities the board will undertake, and these are the kind of actors, it's not a final list, these are the kind of actors that we know we need to have on that board in order to assure that we represent all of the relevant expertise and interests. Some of those you will see lower down are observers, so we do want the expertise but not to influence decision making. Others are going to be the people who actually make decisions. So with that, I'm going to stop and say that that's giving you a helicopter view of, in a way, how we want to respond to what you've heard this morning. Opportunities galore, really on our doorstep with the Champion programme, but also in the future with what you heard from Pierre. Some obligations that you heard about from Nicholas, and how are we trying to find a way forward.